Good morning, everybody, and welcome to Maine Summer Camp's final webinar of the year, setting up the Camp Health Center. We're fortunate enough to have VJ Gibbons as our presenter. And of course, we want to thank Androscoggin Bank for being the sponsor of this year's webinar series. This is the highest tech one we have tried yet, and our fingers are crossed. I'm talking to you from our office in Portland, and VJ is in Alberta, Canada. VJ is Director of Health and Safety at Camp Cedar, and he is also a professor at the University of Alberta. And I will pass it on to VJ.
Well, good morning, everybody. Thanks very much, Ron. And Ron, if there's any questions or anything that come up during the presentation, if you could just let me know, because the screen that I'm seeing right now, I don't see a dialog box. So just let me know if there's anything anybody's asking or raising hand or whatever, okay? So welcome, everybody. I've definitely been in the summer camp business for quite a while. This is going to be my 22nd year coming back to Camp Cedar in Maine. It's been absolutely life-changing for me to be able to have my camp family and to be able to go to camp every summer. Today's presentation is sprinkled with a little bit of my own experiences, but also has, it's a step back and looking at camps more broadly in the state of Maine, and has a framework around how camps operate and should operate versus just the way we do it at my camp. I was fortunate enough to be a part of the Association of Camp Nurses for many years and still am, and I was the president and chairman of the board of directors for 6 years. And in that role, we certainly had to, you have to leave your own personal camp behind and look at representing camp and camp nursing from a much more national perspective. And so I'm hoping that today's presentation will reflect a Maine camp experience, and certainly I'll point out when I've sprinkled in the Camp Cedar flavor or my own experiences. I've tried to provide references for everything that I've found or everything that I'm going to say to ensure that you have those resources to go and double check for yourselves. As a very brief introduction to camp nursing, I think it's important to understand where camps and the experience of camps come from. If you're new to this is your first time going to be going to camp, it's important to realize that this is a big industry. It's in some sense, multi-million-dollar industry. There are certainly much smaller camps and not-for-profit camps, but the camping industry itself is very large and well-connected and is based in research and evidence. And it's about youth development and child development. And really then it's speaking to community development and global citizenship. The Association of Camp Nurses is an organization that is an association of those nurses who have worked in camps and over the years has created its own scope and practice standards. And as such, that scope and standards of practice document is a guiding tool for camp nursing practice. And we're going to talk a little bit more about that later on. I just like to point out that in no way, shape, or form is the Association of Camp Nurses, the ACN, in no way are they a regulatory body or an inspection body. Nobody comes from the ACN to kind of look you up and see if you're doing things right. It's really an opportunity for sharing of best practices, and there's lots of research being done by camps and by camp nurses across the country. So it's a great place to be able to go and find information and fellowship and community of other camp nurses, because it can be quite isolating in some places, in some camps, if you're the only camp nurse or there's one or two of you and you're feeling a little bit out in the woods, so to speak. So the Association of Camp Nurses can provide a little bit more community and support for nurses that are just adjusting to camp for the first or second time. There are different types of camps that we work with. There's in Maine, there's a variety of from a YMCA type camp, an organizational camp that's run by a board, and then the camp director is hired as, you know, for a period of time, and sometimes even like on a year-to-year basis. Other camps are family owned and have been in existence for some up to well over 100 years. And the ownership and the direction of the camp is passed on through family lines. And those can be really, really special places that a strong sense of family and community and family values comes through in the way the camps are operated and run, and they feel like a second home for some people. But I think that regardless of the type of camp, whether it be a day camp, a week-long camp, a 7 or 8 week-long camp, family-owned, organizational run, all camps provide a similar kind of venue for people to come together, form communities, have relationships, and those are the things that keep people coming back. Campers who come back year after year after year, and then come back as staff members, and those staff members continue on for years after that. And the relationships that people form with people at camp, and I'm sure every camp director or longtime camp person has multiple stories of people who met at camp, got married at camp, and now are sending their children to camp. So that's different than any other kind of nursing job that you would ever get. You know, the local hospital down the road, nobody's like telling stories of how they, you know, met their spouse and got married. Now they're having their children come to that hospital. It's not the same kind of job. So that's an important thing to remember, that while this is nursing and it holds all the professional responsibilities and accountabilities that go with being a registered nurse or an LPN or other healthcare provider, all those same rules and regulations apply. It's just a very different environment that you're applying that in. You're going to be working with a variety of different camp staff who have different roles in managing and organizing and maintaining the camp on a daily basis. We're going to talk about about the relationship with the camp directors in just a few moments. But it's also important as the nurse at camp to really get to know the who's who. Who are the heads of activities? Who are the division heads or age group head counselors? Different titles. Generally speaking, there's going to be somebody in charge of a particular activity, somebody in charge of a particular age group or group of cabins. And those are important people to get to know, reach out to, find out what they do on a day-to-day basis, because it will ultimately impact your operation in the health center, whether it be about knowing when trips are going out of camp for intercamp or sports or a day trip or a hike. Wanting to know those things, be able to have that relationship with the people running these activities to make sure that you have a smooth operation, preparing first aid kits, knowing when campers were sick or injured on a trip or away from camp that they haven't seen you yet, to make sure that your expectations as well as theirs are met in advance of, you know, camp even starting. We'll spend a lot of time today in this presentation talking about the role of the camp nurse and where the nurse fits into all of this. There's a lot of specific details that each camp will have in terms of where information is stored, how a nurse would access that, how things are documented, who needs to know what and when. We'll speak a little bit to that, but a lot of that is really going to happen in your individual camp orientation and the sit-down conversation with your director. An hour-long webinar won't be able to address all of those issues. So you may still have some questions at the end of this. I know I will be open to answering questions as best I can. My emails will be at the last slide of this presentation. But there's also other resources that we'll talk about through the presentation for you to get comfortable in your new role as a camp nurse. I've kind of broken this up into like pre-camp, in like while camp's running, and then kind of some of the stuff that goes around regulations of camps. In setting up your health center when you first arrive, just know this, it's going to be a mess. There's going to be dust, there's probably going to be some droppings from the inhabitants of the health center that were there all winter. So there's a lot of cleaning that has to happen when you first get there and first start setting up. My strong recommendation to all camp nurses, one that I almost never ever follow myself and always regret not having done so, is unpack and set up your living area first, because once things get rolling, you'll almost never get a chance to get back and do that. So set up your own living area, your room, your cabin, etc. Get that set up and then get into the health center part and start cleaning. You're going to need to order supplies. There's going to probably be a process for that at your camp. There's several different options, and I'm certainly happy to talk on an individual basis with people about what those options may be for cheaper, quicker, easier ordering. And your camp may already have a plan in place for that, so please check with your camp director. Different places will call the health center different things. It might be called the health lodge, the health hut, health and wellness center. We call ours at my camp the health center. The history, and certainly many camps still call that area the infirmary. We made a change to health center years ago, simply to reflect the bigger role that the health center plays and that the nurses play in daily camp life, that we're not just there to take care of the sick and injured, we're also there to prevent illness and injury and to be a part of the camp life on a day-to-day basis. So that was the rationale for our change. Whatever your camp calls that area, there's likely to be an area where you're taking care of people who come in to see you, campers and staff members. For the sake of today's presentation, I'm going to refer to that space, that area, as the clinic. Whether it's everything is one room or it's a porch, whatever that area may be at your camp, I'm going to refer to that as the clinic, where you would come in, when people could come in and see you, sore throat, runny nose, scratch, bug bites, etc., that we would see them in a clinic area. The setup for that has typically, I think, in many camps, looked very much like a primary care doctor's office. There's going to be some gauze and tongue depressors and Band-Aids and some normal saline and antiseptic solutions, etc. And all that you will set up, and you'll likely have shelves or cabinets or cupboards to set that up with. It's probably stored in Tupperware bins that will be brought out for you. They may have been stored somewhere that was winterproof and then brought up to the health center once the staff started arriving. So look for those kind of things. Again, lots of cleaning, lots of setting up to do. I think my best recommendation for setting up that area, your clinic, will be to think about flow. How do people enter in? Where will they be treated? Where will you be standing? Where will they be standing or sitting? And then how will they exit? And having a nice streamed flow from, if it's one door and then out the other door, that's great. But however you're going to set that up will kind of reflect how the flow should go, so you don't end up getting bottlenecks, and it just may feel more comfortable or at ease for you as you're working in that environment. There will be health forms, and they may be, some camps are using electronic online databases or application software that manages all the information for the camp. In those settings, the camp directors will arrange for training for you in terms of how to access those forms and other information such as parent contact information or allergy information, daily medications, as needed medications, etc. May all be stored in some computer system somewhere. Other camps will have a paper-based system where parents fill out a health form and it's faxed in or brought with the camper to camp. And some camps may send their kids on a bus or collect the campers on a bus and bring them to camp. Other camps will have parents drop them off, and there'll be like a circuit for them to go through in terms of checking in with camp directors, with division heads, and with the nurse. And they may be bringing their medications and health forms at that time, or they may have been sent in advance. That's very individual to how the camp has operated. So find that out from your camp director. One of the things you'll need to do with these health forms, if they're paper-based, will be alphabetizing and organizing them so that you're able to reference them quickly and easily, and reading them so that you are picking out all of the information, such as all of the allergies and who has special requests or needs, or sleepwalkers, bedwetters, things that may not be medication related, but certainly that the nurse would like to know about, and the health form may be the only place that a parent has communicated that. So those lists may need to be shared then with the camp directors, or allergy lists to the kitchen staff related to food allergies, or even to the division heads, so that they know sleepwalkers, bedwetters, etc. There's always that element of privacy that needs to be maintained with these. The personal health information that's contained on the health forms it needs to be kept private and confidential, but it's also meant to be kept private and confidential within that group of people at camp who need to know that information. And that's then a discussion that you'll have with the camp directors in terms of who needs to know what. And I know sometimes as nurses, we feel like, oh, it's been entrusted to us. It remains our duty to maintain the privacy of all that records. But in a camp situation, there are other people who also will need to have that, that information. Laundry, I think, becomes a large part of getting set up in the health center. Sheets and linens and pillows and pillowcases for the inpatient, so to speak, beds, or your infirmary beds for when campers or staff members need to stay overnight in your health center. So those need to be set up. There is a rule about how many beds are required, and that is noted both in the Maine state rules for youth camps, as well as in the American Camp Association standards for accreditation. And it's 1 bed for every person's on camp needs to be available in the health center. So 1 bed for every 50 persons. So you find out how many people are at your camp, do the math, and that's how many beds should really be available in the health center for illness or injury that requires an overnight stay. Not every camp is going to have an emergency bag, but I would suggest that the nurse needs to have we call it the go bag, and it sits right by the door. And it's like a maybe more elaborate first aid kit, but also contains oxygen. Our oxygen go bag is right beside it, so that if we're called out to a field for an emergency, that we don't have to go around looking for stuff. It's all contained in our go bag. Knowing what is there, what emergency supplies and emergency medications that you do have available will be important in that first couple of days that you arrive at camp to make sure that you have all that set up. In my last 20 years, it's almost guaranteed that within the first few hours of me arriving at camp, I've still got my luggage sitting out on the porch and somebody's needing me to come and look at something. So getting that go bag ready is probably a top priority. And then it's going to be important to make sure that you do review the state regulations and other standards that are related to camp health and camp nursing. I have prepared a list of those things on a slide coming up, and it'll be important for you to kind of go through each of those and look at what's there. And it'll help kind of tell you what your job is, what the expectations are, and then have the conversation with the camp directors about how is this enacted and executed here at camp. As staff are arriving, they'll need to be screened for health and wellness. So these are typically called health checks or health screens. And different camps, so there's no single rule about what screening needs to be done, but typically it's making sure immunizations that are required for the camp are up to date, that there's no active illness in terms of upper respiratory or GI, and since 2009, with the H1N1 flu epidemic that occurred, most camps have been checking for temperatures upon arrival. And anybody that has a fever greater than 37.5, 37.8, those people have typically been isolated fairly quickly until proven not infectious. So getting lists of staff members who are coming and the countries that they're coming from, those can often be obtained from a camp director or a program manager or camp manager. Different titles in different places, but somebody will have access to that. They'll be able to provide a list of campers, what areas they've been hired to work in, and probably what countries they've come from, which will be important to looking at, like, what are the risk factors from different areas of the globe in terms of illness and injury. Measles has been on the upswing in multiple countries, including the United States and Canada. We're not immune to that anymore. And so it's important to know where people are coming from, and it might help in flavor your decision-making or your investigation into somebody's presenting symptoms. How are you going to document that so that there's evidence of this health screening having been performed on your staff members? And my own personal experience on this has been that it's often difficult to get the immunization records and the health forms from maybe the all year round permanent staff, full-time staff, maintenance crews, assistant directors, etc., who have been there for years and years and years and years. They're often the more difficult ones to get that health information from. However, their jobs don't make them immune to accidents or illness while they're at camp. So it's important for you to have that information in advance. Allergy lists and EpiPens, etc. All this is also important for you to know about your counselors and your staff members. Different camps will have different rules around whether or not staff medications may be kept by the staff, or if they have to be kept in the health center, or if there's a staff locker room where staff keep their meds locked up in a locker. My best recommendation around that is that medications cannot be in the bunks where the children are. So that's a state rule. So that's full stop. Meds cannot be in the bunks. If the staff if they have their own sleeping quarters or a staff house, that may be more permissible. I would also caution, though, and this is certainly the conversation we have with our staff, you don't want your meds in your bunk, because the bunks are going to get hot and they're going to get humid and your meds are going to melt, and then you're going to be out meds, and that's something that's going to be a problem for you to figure out. It's better for them to be kept in the health center. And then we just bring the meds to each, the staff meds in a bin up to every meal, and the staff come and take their meds. Other camps will actually have the nurse administer doses out to the staff and log those on the on the medication administration record, as well as the campers. That's a personal decision for the camps and the camp directors about how involved they want to be in their staff's daily medication administration. But there's no rule requiring the RN to administer adults their medication. Making sure you know what your community resources are. This is all still pre-camp. Campers haven't even arrived yet, and you've got lots of stuff yet to do. Knowing your local hospital, what services they provide. If they have a lot of the hospitals that have a whole bunch of camps around them, they know you're there, they know you're coming, and they'll probably have a process for you to be able to interact with them. Pre-registering your campers if you're coming to a clinic, an open clinic or an urgent care center. Some of the hospitals provide like an orientation to camp nurses to let them know about how you're going to get outpatient x-rays done, or what outpatient services and providers are available in their facility. So I would go ahead and look that up on the website for the hospital that's nearest you and find out how to access them. This is actually noted in the Maine state rules governing youth camps, is that a list needs to be updated of local providers, including things like dentists and orthodontists, ophthalmologists, and even eyeglass fixing places, as well as medical providers. It's also recommended that you know how to access emergency life flight services for your area if that need should arise. And then just knowing in your area, and all of Maine is 911 accessible, but just knowing the service times for, if you were to call 911, how quickly could you expect an ambulance or fire truck to be able to arrive at your facility. And that will help to influence whether or not you're just stabilizing until EMS arrives, or if you need to actually perform some wilderness first aid stabilization, knowing that you're going to be more than an hour away from definitive medical care. As I've mentioned a couple times about meeting your camp directors, this is one of my camp directors wearing a dress and serving cake with a machete while being very patriotic. I think this was a 4th of July type thing. And so why would he be doing that? Well, of course, because it's camp and that's just what you do. Have that conversation with the directors about how they expect you to interact in camp life, how you're going to find out information, your role in the everyday operations of things going on. How will you find out that there's a team of soccer players from 5 different camps all going to be coming today for a soccer tournament? How would you find that out? And how are you supposed to take care of campers from another camp if they come and show up at the health center? What kind of communication lines will there be between you, the camp director, and parents? Do they want to be notified before you call a parent? And if so, for what reasons, and et cetera, et cetera. So those things really need to be spelled out between you two or multiple persons before the campers even arrive, to make sure that everybody knows what the expectations are. The stories that I've heard from camp nurses is sometimes when the relationship with the camp directors didn't go well, it's often because they never had this expectations meeting. They never had a sit down to say, how do you want me to operate in this situation? And certainly if you're new, you may not even know all the right questions to ask, or new to camp anyway. One of the presentations that I've given in the past is, so who hired the crazy nurse was the name of the presentation. And it was talking about why nurses or how nurses can find camp very anxiety provoking because it's such a foreign environment to come and work in. It's lots of fun. You're wearing shorts and a t-shirt and running shoes, and it's fantastic, and you get to take care of these amazing kids and really fun counselors. But it can also cause a lot of anxiety when the normal things that you are used to having in your nursing practice aren't there. The oxygen spigot is not on the wall. You don't have a code team to call or a rapid response team to call when things are looking a little bit funny or you're not sure what to do. You may or may not have a whole bunch of other staff members to be able to just go and say, hey, can you come and take a look at this with me? So that can cause a lot of anxiety for nurses that are new to camp. Spelling out the expectations with the camp directors early on when you arrive is going to be really important to alleviating some of that stress for you. And also then knowing where the policies and procedures are. Most camps will have some sort of policy and procedure manual for the health center, and if not, they may actually have that contained in different areas, and it's just a matter of having a conversation about those things. And I'm certainly happy to help look for and show you where there are resources for samples or templates of health center manuals, and also for protocols and procedures and medical treatment protocols. Most camps will provide, as part of their staff training, staff orientation, if it's maybe a couple of days or up to a week before the campers arrive. Part of that is often the health talk, or named something similar to that. And this is the nurse's opportunity to share with the staff expectations around how the health center will work, when it's open for business, when you're going to pass medications, specifically the staff members' medications, if the nurses will have those. How to get the nurse outside of those times, for example, over in the middle of the night, and the nurse is sleeping, how are they supposed to access you or wake you up so they're not just walking into your bedroom? And then first aid kit sign out for trips and activity areas, and you're going to need to, it ends up being a real big thing if you don't have a nice system in place in terms of sign outs and knowing the name of the counselor, the trip they're going on, when they're going and when they're coming back. Then putting a tag on each first aid kit with a number so you know what kit they had, so if you know which one is missing and where it went, etc. Staff concerns to talk about include things like health forms, getting the health checks done, that screening process, how you're going to deal with staff medications. I always think it's important to let staff know that you're going to do your utmost best to try and provide them privacy when they come into the clinic, or if they want to talk to you about a personal health issue, because if it's during a clinic time when all the campers are there, that can be a little bit rough to try for them to disclose something personal to the nurse with a whole bunch of kids running around and yelling. Staff insurance, making sure staff members know they need to provide their own insurance. I don't know how many camps there are that are still providing insurance for staff members. I mean, when I started, that was something we did, but that's changed, I think, for everybody a long time ago. So staff members really need to have their own health insurance. And if they don't, having a conversation in advance with the directors and then any of those staff members, so that there's a plan in place if something comes up so that they know how that payment will be handled. And the difference between when it's a personal injury or personal illness versus when it's workers' compensation related. I can't answer those as a general rule or here's how it works, black and white. It's not. It's going to be the camp directors and or the owners of the camp who hold the workers' compensation policy are the best ones to have this conversation with in terms of deciding what constitutes a workers' compensation related claim versus what is the staff member's own responsibility. And I think that's a little bit outside of the scope of today's conversation, but certainly something to have a conversation with your camp directors about. And they may be able to even set you up with a conversation with the Workers' Compensation Board representative that'll work with you and kind of give I know the one that we work with, MEMIC, they have presentations and webinars about, what is a claim and how do you decide what to report and what not to report. And they've been, even when I've just called and asked questions, they're more than happy to kind of talk that through with me in a no-fault kind of environment. But I have that relationship with them over 20 years. If you're new to your camp, it's probably best to go through your camp director and have that conversation with them or through them. Universal precautions. gloves, eye shields, vomit kits, cleanup, blood cleanup, etc. A basketball to the nose may cause a gusher that needs to be taken care of, and it's a contamination all over a basketball court. The staff need to know how to clean that up or how to access supplies, or the nurse or whomever it is that's responsible for cleaning that up. Vomit kits and in the bunks, or in gloves in the bunks. I don't recommend first aid kits in the bunks, because then things are happening outside of the nurse's knowledge. But certainly the staff should have gloves available to them for quick cleanups or quick things that happen in the bunks and or even in their activity areas. The last thing on that list there for universal precautions is something that we've prevented problems by simply having that available, and it's in the health center. And our general rule is just don't wake me up to get this. But other than that, you can certainly come and ask the nurses, and there's supplies available. Some camps will certainly have problems with that from a philosophical or values-oriented system, and that's fine. I'm not saying that's a requirement. It was just something that in our environment, we found that that was a good way of preventing problems. Health and wellness and safety, hydration, sleep, bug spray, sunscreen, poison ivy protection, tick checks. Going over all of that with staff members, they're not necessarily going to recognize the health impacts of those things. You can't overemphasize the health and wellness teaching that the nurse can and should be doing with the staff as well as the campers during staff training, as well as throughout the entire camp season. You're going to want to know about medical conditions of your staff members, but you're also going to want to share the medical conditions of certain campers with certain staff members. It'd be important for activities to know that a camper has diabetes, and if they start sweating or not responding appropriately, or the counselor thinks, oh, the kid's just ignoring me, I'm going to give them a timeout, it may actually be a diabetic-related emergency. So it's important for staff members to know these medical conditions. Again, this is a conversation to have with your camp directors about how they share that information. Allergies, food allergies, certainly the kitchen should know about, and I think there are things that need to be kept secret and private. Allergy lists are something that we should have easily available for people to check if somebody's having any kind of symptom and know what to do about it. And the emergency first aid piece is usually it's what to do until the nurse arrives. That, you know, the basketball to the face on the court. How are you going to just have the kid hold his own nose, head forward until the nurse can get there, or until you can walk the kid over to the health center? Those are the things that our young staff members may not intuitively know, so it needs to be shared. The nurse's orientation to camp. You know, I love my camp and my camp directors, but my very first day at camp, I arrived like late in the night because of flight delays. The next morning, it was like, hey, yeah, we're really glad you're here. So there's the health center. Good luck. See you later. Lunch is at 1. You'll hear a bell. And that was kind of my orientation. There wasn't a lot of production or ceremony to it. I figured it out a lot on my own. And then since then, we've really been working hard on making sure that the nurses are all well-oriented and set up for success. Nurses do need to have a copy of the staff orientation manual or the staff training manual. There's a lot of stuff in there that the nurses need to know. There's even things like just the camp songs or the camp traditions of the clapping games that happen at certain meal times. The nurses are going to want to know that. They may not necessarily always participate in it, but they're going to want to know about those things and feel a part of that, the community that goes with that. The health center manual, this can take on a bunch of different forms. Certainly over my time, we've created it into like it's a binder on a shelf. It's also a PDF file that I can send to all the new hires each year. But it contains like job descriptions and statements of like, here's our goals in the health center. Here's the scope of practice for each of these, you know, nurse, LPN, nursing student. We have a scope of practice statement for each of those. But more importantly, I think we have a scope of practice expectations for the health center in terms of what are we doing here? What is our goal? We're not here to manage crazy illnesses and, you know, severe dehydration, nausea. There's things we can do in our little white hut in the woods. And then there's things that you really need to get referred to local providers, emergency rooms, etc. So that that kind of documentation helps the nurse that's new to the camp understand where they fit in. How much responsibility are they taking on? How accountable are they for managing, and to what level and to what extent? If your camp has a physician on staff, and usually these are like, sometimes it's somebody that's been the camp doctor for years and years and years. It might be a retired physician who just comes and hangs out at the camp and loves it and has been there for decades. That's fantastic. Other camps, it might be a camp parent, and they might rotate on a weekly basis. And that's great when you have a physician on staff or on campus. It does escalate, or I'm just going to say that differently. It increases the scope of practice that the health center can manage when you have that physician right there with you. And then medical treatment protocols, sometimes called standing orders. I think the main state regulations still refer to these as standing orders, but our vernacular around that has changed to be not just standing orders, but treatment protocols that are applied to anybody in that population. So rather than it being like, if this camper Johnny has these conditions, then you should do this for him. And an example of that might be an asthma action plan that's been written out by the primary care physician at home and sent to the camp. And then the nurse can escalate medications, increase doses, added the steroid inhaler, for example, based on the peak flow meter readings. So that would be an example actually of standing orders for a particular camper. Medical treatment protocols are more global in terms of, if somebody presents with these symptoms, these are the questions to ask, and these are the interventions that would go with that. Somebody with a headache, you evaluate and assess for levels of hydration, exposure to the sun, pre-existing migraines, headache history, and then the treatments may involve Tylenol, ibuprofen, fluid and rest, shade, etc. So that would be the difference. It's between medical treatment protocols and standing order. Medical treatment protocols can be applied to anybody in the community or within the population based on defined assessment criteria. Another example of medical treatment protocol that camps really must have in place would be when to initiate an EpiPen based on symptoms, and not necessarily prescribed already pre-prescribed for a camper or for a staff member. And that would designate if they were having these symptoms of swelling, maybe there's hives, difficulty breathing, et cetera, that those symptoms can be then interpreted as likely an anaphylaxis and an EpiPen administered. And I do have a link on a slide coming up to the main state regulations regarding that, specifically around EpiPens, that do, because I think nurses can be really anxious about this, and it actually spells out quite clearly that with the training from an appropriate person, such as a registered nurse, a staff member can administer an EpiPen that was prescribed to the camp for general use, that a camper who has been properly trained, or sorry, a counselor who's been properly trained in that can administer that EpiPen. And that would be really important for those trips away from camp. So there is information to help you figure out how to do that and how that's documented. So I've got a link for that, I think, coming up. This slide's kind of busy, but it's more about providing you with the links for all of these kind of regulatory rule things that I've kind of alluded to so far. The Maine Department of Health and Human Services is one of the main places that you're going to want to familiarize yourself with. This is not all about camp health or camp nursing. It's camp in general, and there's usually a subheading or section around the health center or camp health, etc. The rules related to camps, this is the regulations to camp in general. And there is definitely a section on the health center, and that's where you find the information about how many beds are required, toilet facilities. There's rules around the medications and how they have to be locked up. All meds have to be under lock and key. Scheduled medications, and that includes narcotics and etc. Those all need to be under double lock and key. So that's an important thing to look at and know about. To go over all of these individual little rules would be several hours of our time today. So instead, I've provided you with the link to that information where you're going to be able to find it. There's a couple really important things that if a health inspector were to show up, that they would be asking the nurse for, like, where is this information kept? one of those things would be the notifiable diseases and conditions in Maine. Where's that list so that you have that list, and where's your forms? So the two links are there. One is the main government rule on that. That's the 144 chapter 258. That's a Word document you can download. And then the Maine camps link there actually has the reportable conditions list, the actual form that you fill out and can send in. Now, the next bullet point down, reportable conditions form. This comes out of the health inspection program for camps, and this one is camp specific, whereas the notifiable conditions list is broadly for doctors' offices, clinics, schools, etc., labs. It covers all of those kind of entities. The one under that, the Maine Camps Health Inspection Program, that one is very specific to camps. And it includes things like anybody who's knocked unconscious, that has to be reported. Anybody who's got an animal bite needs to be reported. Anybody who got stitches needs to be reported. And so it's just reportable conditions. The form is super simple. It takes just a minute or two to fill out, and you fax it to the number on the form. And you can always call and ask questions to the program manager, and her name is there. So it's actually a good resource for nurses too, but it's certainly something that the health inspector has asked us for in the past, and lots of times I'm like, oh yeah, I've got that, and I just can't find my form, and then I get in trouble. So I always have those things printed out, multiple copies, put into like a little plastic sleeve and just kind of hung on the back of my office door, so I always know where they are, and we can find them really quickly if we need to use them or if the health inspector's asking us for it. I've also got a copy here, and this from the health inspectors. This is their actual inspection form, so you can see exactly what they're there checking for, and that'll help you to know exactly what things you have to do. What are the rules? Here's actually how they're documenting that. I provided the immunization requirements for school children in Maine. These aren't school children, but they are certainly in a much tighter controlled environment than school children are. Maine has kind of a you must be immunized kind of policy, and to opt out has to be very specific rules. There's also that document there from the Maine Camps website, immunization recommendations, and it really follows the American Camp Association recommendations on the standard immunizations. A DTaP after the age of 7 or before entering grade 7, 2 MMRs, et cetera, et cetera. So there's nothing crazy or unusual, but if you're not familiar with the lists of what immunizations would be required, you can find that information right on that link. The American Camp Association is across the United States, and they kind of set, it's an association for a community of camps, but it also provides an accreditation process. It's voluntary. You don't have to be an accredited camp, but camps who choose to be members of the American Camp Association and choose voluntary accreditation then can be able, that's part of their marketing. They'll say, hey, we are accredited, and we set our bar up here, and these are the things that we meet, and these are the things that you can expect from us. And it's actually a really great program. Even camps that choose not to become accredited usually because of the cost of that, many of those camps still follow the accreditation standards and guidelines. They just choose not to go through the process of being accredited. So I think that's important, because some people come into camp thinking that they're like the ACA is the police, and they come and check out camps, and they don't. They will come and inspect camps on a routine basis for accreditation purposes, but it's not a policing agency. It's there to help camps improve their practices and performances. So there's a link here for the standards at a glance. This is open to the public. And what you would want to scroll down to would be the HW section, which stands for health and wellness. And those are all the things that pertain to the health center. For more detailed information on each of those standards, you actually have to, you have to be a paid member to have access to those documents. And so if your camp is ACA accredited, they will have this information, and you can request that from your camp director to look at. There's a big binder on a shelf somewhere with all that information. I added this Occupational Safety and Health Administration, the OSHA requirements in there. And please take a look at this link. Oh, you know what? I just realized that there was a cut and paste error there. That voluntary accreditation standards at a glance is under the OSHA, and it shouldn't be there. OSHA is not voluntary. Everybody has to follow those rules. So the, here, just, let me do this. Just scratch that part out here. This is not, that's wrong. But this link here is accurate. Check out that. It takes you to a website and explains what is required to be reported immediately within 24 hours. There's even some situations that need to be reported to OSHA within 8 hours. That's would be for a fatality. There are some things that need to be reported, though, within 1 day. And then there's things that need to be reported within 48 hours. And they get quite fidgety if they're not reported on time. A staff member's hospitalization for any reason needs to be reported. And I found that out by accidentally reporting a couple days later than I should have. And it was kind of a big problem. So I shared that with you to learn from my mistakes. And finally, the Association of Camp Nurses, they published the scope and standards of camp nursing practice. It's $8.50 to buy a copy and have it sent to you. You can find that on the education resource section of their website, along with a whole bunch of other camp nursing specific resources for you. Even if you are not a member of the Association of Camp Nurses, which by the way, I highly recommend, but even if you're not a member, if something happened, you would still be held accountable to the scope and standards of practice for camp nursing, whether you were a member or not. So it certainly behooves you to find out what those standards and expectations are. Okay. So here's that EpiPen regulation, a link to that information, as well as, and this is actually found all on the maincamps.org website, Maine Summer Camps. Excellent site, lots and lots of information there, a lot of it really pertinent to camp nursing. And then this emergency medications such as albuterol inhalers, EpiPens, that parents will say, oh, he's really responsible. He needs to be able to carry his own albuterol inhaler at all times. He wears a little fanny pack and he carries it around. Well, Maine said they can do that, but there's some rules around that. It needs to be signed off by the family physician or the pediatrician. There's a form for that, and a parent needs to sign a form, and then the camp staff has to assess the child's ability to self-administer and know when to administer, and then the staff members the camp staff nurses have to sign a form. So these 3 forms need to be in place for a camper to be able to carry their own medication. So it often becomes too much of a hassle for that to get into place, and parents will say, fine, just keep it in the health center. But it's certainly worth a conversation to have with parents when they're setting these things up and expecting them to be on their camper's person. And there certainly are situations where they have to be. They just have to be. So you do what you have to do. The Maine state government has made that available, but there's some requirements to get there. One camp is in session, the campers start arriving. Again, we're going to go back to that screening process for all the campers. That can be a massive operation. Check with your directors how that check-in process will work. And again, it's very similarly to your staff. You're going to be reviewing health forms, making allergy lists, knowing the medical conditions, generating medication administration records if they aren't already generated through an online system. And again, check in with your camp directors about that. That brief physical assessment during the health check portion is usually like any runny nose, fever, headache, etc. Quick listen to the lungs, look at the bottom of the feet for fungus, athlete's foot, etc. Looking for skin rashes and a lice check, and away they go. And how you're going to document that so that you have evidence of having performed those health checks and evidence that that particular camper did not have athlete's foot when they arrived, or that they did have athlete's foot when they arrived, will be important for the ongoing relationship and communication with parents. And then just making sure that you're able to keep things in a semi-private or personal health information is protected at least while we're going through this process. Again, we've talked about the screening of the health forms, and then how you're going to follow up with information that's found. How will you communicate, and what will you communicate to the directors? How will you communicate with parents? And if you're missing health forms, how are parents going to be able to send those to you? Fax, online system, mail, etc. And it's important then to keep your staff and your camper medical forms or health forms separate from each other. They're distinct entities, and the requirements do require that they are separated. We've talked about this. One of the things that bring up would be, do you do mid-season checks? Or we often check, like do another lice check and health check, looking for rashes and et cetera before visiting day when the parents come to visit. So we want to know about things before they get there, and also so we can give parents a heads up so it doesn't have to become their whole day when they're there. And then we do another health check before we send kids home to make sure that we're sending them home in reasonable shape and condition, or if there's something that's come up, a rash, a bug bite that looks kind of gross, that we can let parents know so that they're not surprised by that when their camper jumps off the bus at home. And then how you contact and communicate that all with parents. We've talked a lot about some of these things already in terms of daily clinics or sick call, having specific times for that. On-call emergencies, how is the nurse going to be accessed, what services and et cetera are available. We'll talk a little bit about medication management, and then trip prep and kits to prep for going out of camp. And all the while, all that's happening, the nurse is kind of at the center of this like health and wellness monitoring or risk management kind of process. Some camps, the nurses will do, they call it the daily walkabout, and they actually go and walk around camp, and it's a visual inspection of health and safety risks, such as screens off of the windows on a bunk, or a tree limb that's looking kind of loose and dangling, etc. Looking for potential hazards. Other camps, that's the camp director's role. So it really varies in terms of the practice. So I would just, again, check in with the camp director, and they might be like, I don't know what you're talking about. If something's wrong, we take care of it, which is perfectly fine. But knowing that when it isn't perfectly fine, it always ends up in the health center. So whether the nurse is out there doing a daily walkabout, at the end of the day, the nurse ends up dealing with all of the health and wellness risk management issues that weren't prevented. So it's better to be involved in the prevention piece of it. That's all I'm saying. So your sick call or clinic or whatever you're going to call that, when are you open? If you were not open, for example, and well, how would somebody access you? How would they know? Do you have a radio? Is there a doorbell? Is there a can with a string kind of idea? How are people going to be able to get a hold of you? How will you document care that's provided in the clinic? How will you know to follow up? Somebody came in with a gross little scrape on the back of their leg. You've cleaned it up, put a Band-Aid on. How are you going to remember to have that kid come back later that day or the next day to make sure you're checking on that, to make sure it's not getting gross and infected? How are you going to make sure that you remember, never mind the camper remembering? What processes will you use? That's going to be very individual to what works for each individual nurse or health center. There's some bigger questions about, will you be giving allergy shots or growth hormone shots? How comfortable are you with that? What do you know about those things? Most of the growth hormone producers, the manufacturers, have training videos on their websites. Similarly, the allergy shots. And then the allergy shots will often come with instructions from the home allergist. And I've always just called them and said, hey, I've got questions. How do I do this? Talk to your camp directors about how they've handled this in the past. It may be interpreted for allergy shots that a physician needs to be present in case of emergency. And I know that we've had situations where an escalating dose of allergy serum has resulted in a reaction. Luckily, we decided for that camper that we were actually going to take them to the emergency room and have it done as an outpatient clinic procedure, and they were in the emergency room for that when it happened. But that's a decision that a camp will have to make. Medication management becomes a huge role for the nurse. How do the meds get to you? How do you organize them? How do the meds get to the staff? How are they going to, when do they get to the campers? Do the campers come to the health center? Does the nurse go to the dining hall? How are meds passed? And then how do you document? Our personal operation Camp Cedars is a multi-nurse duty. So one person's got the clipboard with the medication administration record. Somebody's manning the pills and somebody's manning the inhalers. And it's a fairly smooth operation with 3 people. But we're also passing about 200 meds in about 20 minutes at breakfast. So each camp is going to differ on medications, numbers, etc. But it's something that these are the things you're going to have to think about. Storing of the medications so that they don't become overheated or melty in the humidity. And then how do you document meds that were given, not given, the as needed PRN medications, etc. And I think it's really important that nurses not forget that we are also responsible for the documentation of effectiveness of medication, whether it be a PRN or just daily medications, that there's some notation that we are assessing whether or not these things are maintaining the health that they're expected to be doing. The Maine State Board of Nursing has some policies around dispensing of medications. I leave this for you to look at and decide for yourself how your medication administration policies at the camp line up with this. I'm happy to talk to anybody on an individual basis about alternatives or things to think about in how to administer medications. First aid kits need to be packed and ready to go and made available for trips that are going on. Just the basketball team's going to go to another camp to go play basketball, they'll be gone for a couple of hours, they need a first aid kit. What goes in there? What medications are you going to include in a first aid kit? The right kit for the right trip is super important. You can see here I've got some examples of, do you have a first aid kit for the waterfront or for the ropes course? If there's a horse barn, equestrian events shed, etc. Is there a first aid kit for them? What things would be appropriate to put in there? And then for certain work areas, like in the kitchen or the maintenance shop, laundry area. Here's some suggested supplies for a first aid kit, but also know that if you're talking about like an overnight for 3 nights in a remote wilderness area, you're going to need more supplies, and you're going to need maybe some different supplies. And so there's some ideas that you can get from even just Googling wilderness first aid kit. These are just some fun photos from my own experiences of medications that are set up. You can see some daily dosing pills, lots of stock medications, inhaler bins, etc. These are some examples of a clinic room setup, exam rooms, treatment areas. Again, it doesn't have to look like this. These are just some examples to give you an idea if you haven't been to your camp environment yet. I think camp should have an AED, but that's a discussion that the camp needs to have, and the directors will make that decision. IV therapy may not be recommended unless you have a physician present on camp and nurses who are competent in starting an IV. We've talked about a lot of this. The health center logbook is a requirement that in addition to charting on a camper's individual file, that you have a log of everybody who's come into the health center and the reasons for their visit. And that allows you to start looking and seeing trends of like, oh, this is the 4th person that's come in with nausea, vomiting, and diarrhea. Now we have a situation. Scope of practice statement here. Health supervisors could be any of these professionals, but really all of them need to have a CPR, wilderness first aid, and oxygen therapy. Emergency action plans are something that camps will have in place for waterfront emergencies, equestrian emergencies, somebody fell off a horse, for example, a lost camper, severe weather, fire, intruders, etc. These emergency action plans will be on file with the camp director. And it's important for the nurse to know, where do they fit in? What is their responsibility if there was a waterfront emergency? The lifeguards will do their job. When does it become the nurse's role? This is a very busy little chart, and it's just talking about the role differentiation between a registered nurse and a non-nurse. And this comes from the Association of Camp Nurses, and specifically I'm crediting Linda Ursig with this. However, I don't have an exact reference. I'm going to leave that for you to review on your own, and it kind of goes through like knowing what the RN has to do versus what other non-nurse, non-RN staff members could do. And that'll help with your staffing decisions. There's some additional fun articles here that kind of speak to camp health. You can see that Linda Ursig has written both of those articles. She was the original president of the Association of Camp Nurses, and then was the longtime executive director of the association. And she's an absolute wealth of information. Her camp has over 4,000 campers in a day. Just saying, she knows what she's doing. So these are some resources for you. The Association of Camp Nurses also has a book available on its website, The Basics of Camp Nursing. That was also written by Linda Ursig and Myra Pravda. And that brings us to the end. Thank you very much for...
BJ,
yes.
Do you see the question?
I don't. I'm here. Let me see if I can... Yeah, my screen isn't showing me anything like that.
Okay, I will read it to you.
Okay.
Do you see residential camps that have one nurse with a smaller group of campers, staff, total of 50? Some leadership is trying to institute where there is one nurse and then a per diem comes in to give the nurse a day off. It seems like too much for one nurse regardless, but curious if you have seen a camp make it work. Is there an ACN recommendation on this?
No, ACN would never make a ruling like that. That would be counterproductive to the relationship building with the camp directors groups. But can I just clarify, did you say it was like about 50 campers?
50 campers and staff.
And staff. You know, depending on the type of camp that is, if it's a medical special needs camp, would be a very different answer. But if this is a regular, non-special needs oriented sleepaway camp type experience, 50 campers is probably going to be manageable for you, I think, and you know, for the most part of the day, the campers are going to be really involved in their activities. And with 50, I think that may be manageable. And certainly as long as there's somebody who's going to be able to provide a day off here and there, otherwise that would be my concern, that there'd be no downtime. But as long as there's like an understanding between the directors and the nurse about in terms of, but I can't just work 24 hours a day. There also needs to be time where I'm not working. So how are we going to organize that?
And then the follow-up to that is, what about passing out meds 4 times a day?
Yep, that certainly can be a challenge. Do you know how many meds you're going to be having? Like with 50 participants, you know, if you estimate about 30% of them having medications, that would probably be okay. But I'd love to talk with you about like maybe how you organize your medications and how you organize the medication passes. How are the meds coming to you and how are they processed? Okay. Because that will change that.
How about if we do this? How about if I give you the person's contact information?
Perfect.
All right. Then we have another question which I was about to ask you, and that is, will you send me the PDF, the PowerPoint presentation so I can post it along with this video?
Yes, absolutely. That was absolutely my intention.
Excellent. And are there any other questions? I don't see any more. But I have, first of all, I want to thank you again for doing this presentation. I think it's been very helpful. Somebody raised their hand. Can't find it. I'm looking. Here's one. How do you get around the issue of sending a camper with meds on an overnight trip when the RN by law cannot dispense?
Right. Well, yeah. So the qualification for that would then be under the rules that on the Maine State Board of Nursing, they have a section there about providing a limited dose quantity and it would be because they weren't thinking about camps when they wrote these rules. But if you were to think about like an emergency room nurse who's, you know, let's say it's a Sunday night and the patient has been given a new prescription and there's no pharmacies open until whenever time. So the nurse would then package like a very small, several day, like maybe a dose for tonight and a dose for tomorrow morning to go. So those rules are set up already under the Maine State Board of Nursing. On that same link will take you there. And that spells out like that is not considered dispensing. It's administering doses in advance for a very specific person under specific circumstances and conditions. And that would, I think, translate over to the camp nurse is just preparing specific doses to be given on these dates and times until they can come back to the camp and be administered by the nurse.
Okay. And one other thing, not for you, but for people listening, Although this is our final webinar before camp starts, Chalmers Insurance is offering a webinar on communicable disease at camp, and it is in collaboration with the Association of Camp Nurses. And in the latest hall monitor, there was a link for you to register. And with that, again, thank you, Androscoggin Bank, and also a huge thank you to AJ. Anything else? All right, we're done. Thank you.
Thank you very much. And please feel free to email me with your individual questions. Happy to chat with you.